Good morning. My name is Dr. Tom Cherian. I'm a liver transplant surgeon. So today I wanted to discuss something called hepatocellular carcinoma, what many people would call liver cancers. It is the fifth most frequent cancer as per the diagnosis, but the second largest in terms of cancer deaths. So what that means is that we are letting more patients die than are being diagnosed with hepatocellular carcinoma or liver cancers. So in other words, we are not doing so well in their management. So what is the risk factor for hepatocellular carcinoma? It is cirrhosis. This fact is very important to know so that it will improve our management of this disease. So any disease that can cause cirrhosis, like viral hepatitis, hepatitis B, hepatitis C, fatty liver disease, alcohol, can all cause subsequently HCC or hepatocellular carcinoma. Except that hepatitis B is one of those rare diseases, interestingly, that can cause HCC to come even before the onset of cirrhosis. But even in hepatitis B and C, only about 5 to 10% of patients with hep B or hep C get HCC. But 90% of HCCs happen in cirrhotics. It goes through stages, obviously, from a normal liver to a cirrhotic liver, and then a cirrhotic liver that develops HCC. So, how big is this problem of HCC? Well, you'll be surprised to know that even though many people have not even heard of HCC, nearly 120,000 people in our country, in India, are dying from HCC every year. That's the same as the number who's dying from road traffic accidents. But still, nobody is talking about it. So I thought, as a liver surgeon, I better talk about it. So the first question that people want to know is, what are the symptoms of HCC? Well, the most important fact to remember is that in the early stages, HCC has no symptoms. It can cause jaundice, which is the yellow discoloration of the skin. It can cause weight loss, tiredness. It can cause water in the tummy. All of this are symptoms of HCC, but of advanced HCC. If we are to find HCC at an early stage, we must do blood investigations and simple scanning tests such as an ultrasound or a CT scan. And because symptoms appear rather late, it is crucial to find this early. And if you think about it, a few blood tests and an ultrasound scan probably cost about 1,500 or maybe 1,800 rupees. If our entire family goes out for dinner and a movie, I think we will spend nearly 2,000 rupees, won't we? So isn't that money that can save a life worth it? So I think it is worth doing. Apart from diagnosing, we need to find out what are the treatment options available for HCC. Why I talked so much about diagnosing it early is that there are many treatment options if found early, starting from radiofrequency ablation, transarterial chemoembolization, so-called TACE. But all these becomes not available if it is reached an advanced stage. In the advanced stages, surgery is not possible. Why surgery is so important is that whilst the other modalities of treatment only increase survival maybe by 9 months, 12 months, surgery is the only treatment that can cure a patient of HCC. In selected cases, transplantation is a good option for HCC because it removes the tumors as well as the diseased liver. But again, advanced HCC is not suitable for transplantation. In fact, because we are a liver transplant center, we have set up a specialist unit to look after HCCs. And in the last year, we have performed about maybe 30 or 25 liver resections for HCC, both in cirrhotics, those who have cirrhotic livers, and non-cirrhotic patients. This is non-cirrhotic liver resections are done in a few other places, but liver resections, that is liver surgery in people with cirrhosis, are not very frequently done because it's quite complex. Complication rates are very high, and because we deal with liver transplantation and people with cirrhosis all the time, we find we are able to complete these resections fairly successfully. Another option that we must talk about when talking about operating on cirrhotic patients is laparoscopic liver surgery. Because liver surgery is complex as compared to most other abdominal operations, laparoscopic surgery or keyhole surgery, which has been used in abdominal operations for the last 25 years, is still not so commonly done in liver surgery. That is because inside the liver, there are no real landmarks that are easily visible. And because of the large amount of blood flow through this organ, a small mistake can lead to a life-threatening bleed in a laparoscopic liver operation, which is why it is not so frequently done. Vital structures are close by, therefore the margin of error is very small. However, again, because of the experience of 200, 300 liver operations, recently, maybe about 3 or 4 years ago, we've started doing laparoscopic liver resections, anatomical laparoscopic liver resections like a right hepatectomy, right posterior sectionectomy for HCCs in normal patients and smaller resections in cirrhotics using the keyhole method. Patients get better faster, they stay in hospital less, they have less pain, and there is some evidence that the overall complication rate is also lower. But whether these patients can undergo laparoscopic liver resection or keyhole liver surgery depends on the type of livers they have, depends on the size of the tumor, depends on the location of the tumor, etc. And therefore, we selectively use laparoscopic liver resections. When that is not possible, we go ahead and do an operation in the old-fashioned open technique, because at the end of the day, removal of the cancer is more important than how we actually achieve it. Thank you.